Hi, my name is Dr. Duncan McCollum. I'm so excited to have you here to find out about this two words, peripheral neuropathy. Now, if you've been diagnosed with this or heard this condition before, you know that it can actually steal your independence and your freedom. So we have found some amazing ways to turn this condition around. And if we catch it early enough, we can actually make really rapid progress. The longer we wait, the harder it is. But I have Dr. Dan McClyman here. He's an expert in this area, and I'm real excited to be able to utilize what he is teaching us so that we can give you the best possible results.
Well, thank you, Dr. Duncan. It is an honor to be on here with you with everything you've done over the years. In our practice, our expertise is peripheral neuropathy, and we've been very blessed to help thousands of people with this condition over the years. And we take an approach, I describe it as a separate toolbox, separate and distinct from the traditional care model, which is basically a series of band-aiding symptoms. However, the toolbox we work from acknowledges and honors the body's ability to heal and repair tissue from the inside out when it's given the proper environment. So over the years, we've been able to work with people from a perspective of home care as well as in-office care to tap into and leverage their body's ability to heal and repair those nerves faster than they're breaking down. And it just restores hope. It gives people clarity and hope and a solution for this peripheral neuropathy.
Yeah, we're so excited to utilize some of the systems that you've taught us. And one thing I know is the whole is greater than the sum of the parts. And there's so many bits and pieces that people have been told to do for this thing called peripheral neuropathy. And when you put together the systems that you have, the greater amount of help people get. It's just astounding to see what we're doing to help people with this condition.
I mean, you hit the nail on the head there. I tell people it's an all hands on deck approach, especially in the beginning. And there's a synergy to the different components of it where they all work together, because what we have in reality is a freight train of momentum breaking those nerves down faster than the body can repair them. So
Right.
in the beginning, we do more things more often to slow it down, stop it, and get it coming back. So there is that synergy of the approach.
We're going to go ahead and have you watch the rest of this video, and then we'll get with you to see whether or not we can help you with this condition. We'll see you soon. Hi, my name is Dr. Duncan McCollum, and thank you for your interest in peripheral neuropathy and what we have to offer. You know, they say all roads lead to Rome. Well, it seems like all diseases lead to peripheral neuropathy, from diabetes, cancer, radiation, so many different things are leading to the peripheral nerves, or the nerves in the lower part of your body, starting to shrink and die, and it can cause devastating effects. So there's two words you never want to hear: peripheral neuropathy. Yet 25 million Americans have been diagnosed with peripheral neuropathy. Millions more have no clue as to what it is. The central nervous system, or the CNS, is the brain and all the nerves inside the spinal column. And I've equated that to a house and all of the stuff inside the house, where the peripheral nervous system, or the PNS, is the 31 pairs of nerves that exit the spine, serving the 75 trillion cells in your body. The vagus nerve controls the autonomic nervous system, which comes out of the top of your nervous system, the top bone, called C1. What is peripheral neuropathy? Well, peripheral means outside, and neuropathy means a pathology or a damaging of the nerve. So anything that damages the nerves of the body, aberrant or wrong communications of information to and from the brain and body, or partial communication, or lack of communication altogether. These are different types of peripheral neuropathy. Every nerve in the peripheral nervous system has a specific job. Sensory nerves that receive sensations such as temperature, pain, vibration, touch, hot and cold. Motor nerves, of course, which control your movement. And the autonomic nervous system, such as the blood pressure, sweating, heart rate, digestion, bladder control. This is the vagus nerve. Oftentimes, this starts with pins and needles in your hands and feet. It can be numbness or burning or aching. Some of the devastating effects of peripheral neuropathy, and there's many as they start to escalate, but it could be trouble walking, balance issues, trouble sleeping, burning, freezing, difficulty driving, which is really scary because when you can't tell if you're putting your foot on the gas or the brake and you're guessing, or you're starting to wonder if you really can feel the difference, you're endangering not only your lives, but the lives of others. And I've had patients just the other day told me that. She goes, sometimes I can't tell. And she's wondering what she should do about it. And I'm talking to her about something that we know that will work, but she has to get agreement with her spouse, which she doesn't think will be willing to do something for it, which is really a shame. Loss of independence is one thing that occurs because, when you can no longer get around or are afraid of falling, you don't want to go shopping, you don't want to go to the games of your grandchildren because you're afraid you'll stumble or step in a gopher hole somewhere. You can't walk the dog. It's hard to walk on uneven surfaces, like going to the beach. You have falls or complications. And it can have a huge mental and emotional effect, fear, anxiety, and depression. And what we see oftentimes, like a patient came in the other day who stepped off a curb onto a lawn, hit a gopher hole, and fell forward and hit her nose and got a black eye and did some damage to one of her cheekbones. And she said, well, I just fell. See, when you didn't have the peripheral neuropathy, you would catch yourself, your foot would right itself, and you would catch your balance. But as we start to lose that brain-body connection from the gyroscope in our ears down to our feet, we start to have more of these injuries occur and these falls and other things, let alone when people have cuts on their feet and you can't feel them. This is, becomes a very dangerous problem because you can get infections that you're not aware of until they become bad. Some of the many causes of peripheral neuropathy. So the number one cause is diabetes. 60% of the US population are diabetic or pre-diabetic, and 30 to 40% of them who are diabetic will develop peripheral neuropathy, 30 to 40%. The sooner you catch this, the better. Diabetes can be reversed if you catch it soon enough with diet and exercise alone, according to the National Institute of Health, 1996. Chemotherapy. Cancer is the second leading cause of death in the United States. Globally, 57% of cancer cases, 17 million require chemotherapy. In 2018, that is, and then 2020, 26 million new cases occurred, of which 53 or 15 million people needed chemotherapy. So chemotherapy does damage the peripheral nerves and adds to this peripheral neuropathy. The cool thing is it can be helped. Just know it can be helped. Science shows that the peripheral nerves grow a millimeter a day if you can do more of the right things than the wrong things to help those grow. So there is a technology on that. Radiation therapy, another huge thing that causes peripheral neuropathy. And 50% of all cancer patients will receive radiation treatment before, during, or after surgery. And that's a huge factor in people that get peripheral neuropathy. Now, usually, and I'll go into the traditional treatment in a minute, but that's from the Lancet Oncological Journal. So trauma, spinal injuries, structural injuries are potential causes. Vitamin B or 12 deficiency, mineral deficiency, toxic chemicals, and poisoning. In 2021, there were 627 per 100,000 reported poisonings. Autoimmune disease, third most common disease in the United States now is autoimmune disease. It used to be accidents and properly prescribed medications that are killing people. Now, tied with all of those are autoimmune disease, third most common cause of peripheral neuropathy and death, actually. Medications, cholesterol, high blood pressure meds, and many others. Alcohol, chronic abuse of alcohol, cigarette smoking, repetitive trauma, infections, hereditary diseases, which isn't huge, tumors, bone marrow disorders, and other diseases. A lot of time people go, well, isn't it hereditary? whatever their spinal injury. Well, my mom had low back pain. Doesn't mean that you are going to have low back pain or neck pain or scoliosis. Most of it is caused by the environment that you grew up in. So initially, what one thing that we do is we do thermographic imaging of your hands and feet when you come into the office. And the first thing we're looking for is a poor blood flow, because this causes the tissues and the nerve damage or the symptoms, which could be start with achiness, weakness, burning and tingling, numbness or pain, and sensory loss. So usually what we see is the most of the foot from the ankle heading down towards the toes is going to be very yellow or white. And then as you go down towards the toes, it starts to turn orange, then red, then purple, then black. And that is the lack of blood. So as your peripheral nerves in those extremities lose the blood, the nerves die, the cells die. That's why diabetes is the #1 cause of preventable amputation right now. And peripheral neuropathy is the reason why. First thing that happens is those toes and hands stop getting the correct nerve supply and blood supply, and mainly because of the sticky blood vessels going through those sticky blood cells, red blood cells, trying to make it through those capillaries get plugged up. And then they're just like on the highway 1 going south at rush hour, nothing gets through. And then those cells that are needing and wanting that oxygen don't get it, and then they end up dying. So peripheral neuropathy, there is a degenerative scale. It starts at 0, then to 25, 50, 75, and 100% degeneration. The main thing is the myelin sheath, which is the protective coating that goes around the nerves. It's kind of like the light that plugs into your wall. There's the copper wire in there in the middle that transmit the signal. And then there is the plastic around the wire to stop everybody from getting electrocuted and protecting that cord. So around all of your nerves are myelin sheaths that protect the nerve all the way down to your toes. And also they're loaded with blood vessels to keep the nerves alive. So as the toxins in the environment, the chemotherapy, the radiation, the injury, the chemical pollutants, the plugging of the blood vessels, any of those things, alcohol, smoking, start to damage the periphery, what happens is that the myelin sheath starts to die, and then you cut off the oxygen to the nerve will start to die. We can catch it up to 75%. We are still able to reverse it in 99% of the cases, or over 90% of the cases. So the sensory loss and nerve damage severity chart says as long as you're, not completely and permanently, the nerve is completely dead, then there's a good chance for it to come back. But what we're hearing is because that nerve is alive somewhere along the pathway, no matter how far up your foot, those nerves do grow by 1 millimeter a day if you do the right things. And that's what we are equipped to help you do. Without oxygen, the nerves die. Now, the traditional treatment for these are gabapentin, which is, and they call it an off-label drug. If you've ever learned that term before, off-label means that it was used for something else. And in this case, gabapentin and many of the other drugs I'll mention in a minute were designed for epileptic seizures. And so if you're taking gabapentin, it's an epileptic seizure drug, which basically they found covered up some of the burning and stabbing sensations that you get with peripheral neuropathy. Lyrica is another one. Other medications are Cymbalta, and then oftentimes you'll get injections, epidural. Oftentimes people, not often, but they get tarsal tunnel surgery, which is surgery of your in your ankle, and or compression socks. So rather than try to repair the nerve and get the oxygen back down to the tissue at the end, they just keep doing things until covering up the symptoms. And what ends up happening is those nerves continue to die. Pretty soon you're faced with potential more surgical
handlings to correct the problem. And oftentimes people get toxicity in the blood from these damaged tissues, and that becomes a major life-threatening problem. A lot of times people are taking lots of medications, and you can't medicate yourself out of a chronic condition. So that's why 75% of the drugs we take in this country are made to cover up symptoms, but you can't medicate yourself out of a chronic condition. There is no magic pill for all this. There's just covering it up and waiting for the next foot to drop, no pun intended. However, something can be done about it. Reversing neuropathy naturally without drugs, injections, or surgery. There is help on the horizon. There are over 20,000 or 2,000 research articles in therapy on the technology that we utilize in my office, which is the research is robust and testimonials are plentiful. We can restore blood flow to the peripheral nerves if done, if you decide to do it correctly. And it's not a quick fix pill. It's taken you a long time to get there. But if you do some of the things that we recommend, in fact, it would be the things we recommend, you can actually start to see changes here. And I'll tell you a story in a minute. But the peripheral neuropathy, the peripheral nerves do regenerate. There's something called angiogenesis. Genesis means new or fresh life. Angio means blood vessel. So you get new blood vessel life or growth by going through processes of making sure that you're getting the right nutrients down into that extremity area, making sure that we're utilizing different types of infrared and ultraviolet light at the right frequencies at the right times and sequences, along with some stuff called biofeedback that can actually start to restore and repair and regrow these nerves. So we can retrain the nerves as well. And there's something called biofeedback. And this particular system, biofeedback is something that sends signals from the area in the periphery up to the brain and back. And it does it 8 times a second. And it modulates based on the communication going up and down the nerve. And it will help restore and reshape the nerve signal. So oftentimes, like when you're listening to a radio, you get static on there and you can kind of tune it in a little better. That's what the rebuilder does. And the best way for me to think about it is if you're going to walk through a field and there's no path, you just kind of start off walking, you end up with stickers in your feet and foxtails climbing in your socks and all that kind of stuff. And it's a pretty rough result. But if you keep walking that same path over and over and over again, pretty soon there will be a path and it will get wider and wider and the weeds won't grow in there, right? Well, that's what the retrainer does. That's what the biofeedback machine does. It will help restore proper nerve communication and rebuild those nerves along with the red light that is going to increase angiogenesis so you get more oxygen down there. And then we want to reestablish the oxygenation of the nerves. And we do that through the 2 things that I mentioned. Also, some supplementation is very necessary to help get nitric oxide into the bloodstream and down into those distant regions of the nervous system and the circulatory system, because that nitric oxide will also help to get the blood vessels and the nerves and everything working correctly and growing again. So the other things is sometimes we have to detoxify the body on an individual basis. I won't go in that today, and of course, make sure the nervous system is working at the nerve itself. And what we see in 12 weeks is the beginning time that we will do the second test. We start to see tissue healing, blood flow normalizing, improved walking and balance, increase and enhanced sensation in the area, the ability to start to get some of your independence back, as well as some of the quality of life. Now, this happens over a period of months and months and months, because it wasn't something that happened overnight. There is no quick fix. But if we're moving in the right direction versus the wrong direction, you are going to be able to get a lot of gains back from this. So the whole is greater than the sum of the parts. So you can't just piecemeal this together. We want to restore blood flow to the damaged tissue through microcirculation, the nitric oxide, and various ways we deliver that, retrain or re-educate the proper nerve function, the principles of neuroplasty, meaning the nerves will grow back via biofeedback, reduce the toxins and inflammation, detoxify, different techniques, and balance the blood sugar and hormones. We've got to fix the cell to get well. Today, we get great results. Up to 97% improvement in sensation, reduction of pain, 92%, improvement in balance, average improvement in balance about 85%. The greatest physician who ever lives right inside of you, and that's who we are teaming up with. So we're teaming up with the greatest physician who ever lived so that we can get the right results. MARIAH at mccollumwellness.com, Mariah at mccollumwellness.com, MCCOLLUM, alphabetical order on the vowels. And we will send you some information. And then if appropriate, and it looks like we may be in the right path, we'll have you come in for a complimentary thermographic picture of your feet. And then once we do that, if it looks like we might be able to help you, we'll schedule a time for you to come back. But anyway, that's the peripheral neuropathy information.